Caring Unveiled with Jarrett Stull.
Welcome to Caring Unveiled, a quarterly program brought to you by Memorial Health Foundation. This series gives you a behind-the-scenes look at the compassionate care being delivered across our region and introduces you to the people and services making a difference every day for our communities. Today's episode focuses on emergency care, specifically the Pediatric Emergency Department at Memorial Health's Belpre Medical Campus. Opened in partnership with Akron Children's in 2024, this dedicated space is designed with children and families in mind and fills a critical need in our region. We recently sat down with Lori Adams, Director of Emergency Services, to get an overview of Memorial Health System's emergency departments and what makes pediatric emergency care different. Lori, thank you for joining us today.
Well, thank you for having me.
Well, let's start by you telling the viewers a little bit about yourself. I know you've been at the forefront of our ED expansion across our health system for quite a few years. So tell us a little about that.
I've been with the health system for 18 years and counting. Started at our main campus, the only ER that we had. And along my journey, the first step was when actually we acquired Selby, and then building our area's first freestanding emergency department in Belpre. And then along the way, we got Sistersville, touched our foot over in West Virginia a little bit, and then the PEDS-ED and Athens ER.
Can you talk a little bit more about the role that our emergency departments really do play really across our region?
You know, we have an amazing CEO, Mr. Cantley. He's very innovative, liking to bring the first things to our area. And so the Pediatric Emergency Department is also one of the first specialized pediatric care areas that we have. You know, we are open from 2 p.m. until midnight. Not a 24-hour shop, but that is when most pediatric patients are seeking care after school, after daycares, after parents get home. So we're especially equipped in all of our ERs. All of our ERs are trained and have the equipment, all the things needed to provide that life-saving intervention that's needed. If your child is ill or needs emergency care and it's outside that 2 to midnight time frame, that our providers in all of our ERs are trained through emergency medicine residency how to care for pediatrics. So they're still getting that top-of-the-notch care when they come to our ERs.
The other question I sometimes get is, when should I go to the pediatric ED versus an urgent care? And I'm sure you have heard that too.
We have, and we welcome them to come at either location, whichever they feel is best. You know, the decision making, most parents will try to make that, and if it's not the correct one, it's okay. We'll get them to the right place. But our ERs will see things that, you know, our urgent care typed patients, not a problem. We'll still see you and take care of you there too.
So you have been here to see all of our growth on the Belpre campus that started several years ago, and our pediatric emergency department is in Belpre as well today. Can you talk some about why the Belpre location is so important to this region?
Sure. Pretty positive that all started when we have this vision of a women's and children's facility within our organization and where to place that. I think space took into consideration, but also a great location that's a midpoint for our entire footprint that we have established, which made sense. We had space already in our current building to create the Pediatric Emergency Department, which will service the Women's and Children's Hospital that's soon to come.
And I hear Mr. Cantley say all the time that we had the space. Why not get the emergency department, pediatric emergency department, started before Women's and Children's gets here? It just made sense for us to do that. And you're right, the geographic location for our Belpre campus that started several years ago, about 1/3 of our patients come from West Virginia, and so that's easy for them to access. I know with our Athens campus open that we are seeing more and more patients choosing to come to Belpre and Marietta for additional services that may not be in Belpre yet. And so geographically, Belpre is a fantastic location for our region to be able to access the care
It
that they
makes
need.
sense. Yeah.
So we've talked about the Pediatric ED and the Women's and Children's Hospital that's coming soon, but we haven't talked about our partner in all of this. So we knew we couldn't do it alone, and so we looked for a great partner that would be a good fit to us, and we found Akron Children's Hospital that's been helping us along the way, truly in a great collaboration. Do you want to talk a little bit about everything that's gone into this process and how we're working together?
Sure, Jarrett. So projects like this do not happen overnight, and they certainly don't happen through the work of one department. Bringing the Pediatric Emergency Department to life required years of planning, collaboration, and shared commitment to improving care for children and families across our region. This effort from Memorial Health System and Akron Children's involved clinical leaders, physicians, nurses, operational teams, facilities, executive leadership, all working together toward the same goal. A tremendous amount of thought went into every detail, from workflow design and staffing models to safety considerations and the overall patient and family experience. What I'm most proud of is the level of collaboration throughout the process. There was a genuine understanding that this was not simply about opening another department. It was about investing in the future of pediatric healthcare within our system and ensuring families have access to specialized emergency care close to home. Seeing that vision became a reality in 2024, it was incredibly rewarding, and it truly reflects Memorial Health System's commitment to innovation, patient-centered care, and meeting the evolving needs of our community.
Truly takes a lot of people to make this happen, and while the Pediatric ED to some may look like it just opened up and we opened the doors, it was really a lot of people behind that and years of planning, just like the Women's and Children's Hospital is.
Yes, there has been.
From your perspective as a leader in Memorial Health System, what makes this emergency department unique?
We really tailored that department to really focus on the pediatric population. For pediatrics to walk into any of our other ERs, it can be very scary. There's lots of beeping, there's lots of noises, radios from EMS calls coming in. It's very overwhelming for adults, much less pediatrics. So our fantastic design people, they did such a phenomenal job giving us this beautiful ER that really, really focuses on calming these pediatric patients when they come in. The nursing team, they really focus on patient-centered care, involving their caregivers with them, because that's how we have good outcomes from their treatment, is involving the caregivers in the plan, in the process, in the care plan, in the discharge home. But we have the colors, the paintings, the pictures, the environment itself is just very focused on pediatrics.
I know our viewers are seeing some of the behind the scenes and what those designs look like now, but the first time I walked in, I was kind of blown away because I was expecting it to look very small kid, but it cuts across all of those age groups, and I think you said something important, that the space was designed to help be calming for kids, but I can tell you from personal experience, it's also calming for parents and how it's designed too, and how you're approached and from the staff, because you talked about how fantastic our staff is, and they are. We hear high marks all the time about how wonderful all of our nurses, our technicians, our physicians are, and that was one, I know with Mr. Canley, that was a very big part of making the decision on who we were going to partner with us for this, because we wanted them to have the same culture that we have and provide the same level of care to the patients.
Our pediatric emergency medicine trained docs that are working in the ER, they are highly focused on being in the room quickly. Our throughput and getting them discharged home is better than any other ER. So they do a fantastic job with that.
Thank you for joining us today to talk some about the emergency departments and the pediatric emergency department. Hope our viewers have a better sense for what to expect if they visit us to come there, and we look forward to what's more to come with the Women's and Children's Hospital soon. We'll have you back to talk about how everything is working then.
I will be here.
All right. Thank
you, Jarrett.
Thank you to Lori Adams for sharing her insight, and to the members of Memorial Health System's Pediatric Emergency Department for the leadership and care they bring to this important work every day. Together, their work represents a significant investment in the health and well-being of children and families across our region, providing specialized emergency care when it's needed most, close to home. And to our viewers, thank you for your continued support of Memorial Health Foundation. Your generosity plays a vital role in expanding access to care and strengthening health services throughout our communities. Be sure to watch for the next edition of Caring Unveiled. If there's a program or service you would like us to feature in a future episode, we'd love to hear from you. Until next time, thank you for being a part of our mission.